Hello, everybody, and welcome to Ty and Sky's Health Pub. Today, we are joined by Sarah, a hepatitis prevention coordinator for the North Dakota State Department of Health, and we will be discussing hepatitis C with her. So thank you for joining us on the show today.
Thank you for having me.
So I guess maybe just to get us rolling, first of all, why don't we have you describe for us what is hepatitis C virus?
So first, I think we should start off by talking about what is hepatitis. So hepatitis is a very general term, and it simply means inflammation of the liver. The liver is an organ in your body. It's very large. It handles a multitude of different things. And so there's a lot of different things that can cause hepatitis. Toxins, alcohol, viruses, and different things can all cause hepatitis. So for then go a step further, we deal mostly with the viral forms of hepatitis. Okay, so when someone says that they have hepatitis, they could have hepatitis due to a lot of different things. It doesn't always mean one specific thing, and a lot of people get confused with that. And so then there's a lot of differentiating things that you have to consider, even then amongst the different viral types. So there's hepatitis A, hepatitis B, hepatitis C. There are some others, but those are not common in the United States, so we don't really focus on them at all. Okay, so hepatitis C is a virus that infects your liver.
And is hepatitis C the most common then of all types of hepatitis in the United States then?
Yes.
Okay.
Yes.
Okay. And kind of those letters you gave us, those are all hepatitis viruses.
Right.
Because you mentioned there are other things that can cause hepatitis.
Right.
And quick before we dig into hepatitis C, what are some of those other things that can cause hepatitis other than a virus?
So other than a virus, toxins in your body, alcohol is a big one. Other things like certain medications can cause hepatitis as well.
And can I live without my liver? Can I just chuck that thing once it gets infected and be done with it?
No, you cannot live without your liver.
Okay. What does it do for me?
Your liver has over 500 vital bodily functions. Okay. So yes, so your liver does a lot of things. It processes things that you eat and drink. It filters your stuff so that you are clean and healthy. There's no way that you can live without it. Your liver actually has the ability to regenerate itself too. So if it's injured, it can fix itself to a certain extent. You can harm your liver to the point where it can't do that, but it does have that ability to do that because it is so important in your body.
Like the Wolverine or Deadpool.
Oh yeah, especially Deadpool. So you spoke a little bit about how someone gets hepatitis C. Who is at most at risk of contracting hepatitis C?
So hepatitis C is spread through blood. Okay, so it's a blood-borne virus, and you get it by multiple sticks through the skin. So blood on a skin, like if you don't have any cuts, you can't get hepatitis C that way. But if you're poking your skin or you have a cut and that gets into your cut, that's how hepatitis C is spread. So today, the most common way that hepatitis C is spread is through the sharing of needles. Whether those needles are used for injection drug use is the most common way that people are getting hepatitis C. They're sharing those needles.
And are there any other ways that people can get hepatitis C other than specifically injecting drugs?
So it's blood. So technically, anytime you would be exposed to someone's blood and it would get through your skin, you could get hepatitis C. Healthcare workers, if they're doing procedures and have an accidental needle stick, they can get hepatitis C that way. If you have tattoos, if you get those tattoos in the home setting instead of a commercial parlor, sometimes needles can be reused then, and so that can pose a risk. Blood transfusions, prior to 1992, you could get hepatitis C through blood. Starting in 92 is when they screened the blood supply. So if you've had a blood transfusion prior to that, you have to be screened for hepatitis C.
Okay, and so just to be clear, if you're having any blood transfused since then, there's no risk at all.
No.
Okay.
No.
Okay, of hepatitis C spread. So hepatitis C is spread through contact of someone else who has the virus, their blood coming in contact with your blood. Is that also the same for other bodily fluids? Like saliva or semen or anything like that?
Nope, hepatitis C is in blood.
Okay, so strictly in blood.
Yes,
okay.
You don't have to worry about those other fluids.
What are some of the early symptoms that might develop in a person that has Hep C?
So unfortunately, hepatitis C is like a silent type of infection. Most people don't notice the signs or symptoms, nor do they have them. So when you first get infected with hepatitis C, they call it an acute infection, meaning you can have that infection, and that acute is the first 6 months of infection. If you were going to show signs or symptoms, the biggest one you might notice is being yellow. The technical term is jaundice. So the skin turns yellow, or the whites of your eyes will turn yellow.
Really?
Yeah. I've
really
seen someone with jaundice, and it's visibly noticeable.
Really? So they look visibly yellow.
They look visibly yellow.
Yellow
your skin
eyes,
will turn.
Yellow. Wow.
I thought it was pretty crazy looking. But yeah, but unfortunately, most people don't have that symptom. It's upwards of 80% of people don't have any signs or symptoms. If you don't have that jaundice, you could have general stomach flu-like type symptoms like nausea, vomiting, diarrhea, tired. None of those things are very specific towards hepatitis. That jaundice means something's happening with your liver. So it can mean any type of hepatitis, but that's what's going to signal you to go in and get tested.
Okay. And so we talked about, you mentioned it can turn you yellow. So other people would notice that, and obviously you might get some comments about being yellow. Or you may have like kind of a flu-like illness or an upset stomach, other things like that. But why is hepatitis C a problem? I mean, beyond that, beyond some discomfort or maybe a change of the color of your skin.
So hepatitis C, you can have hepatitis C for a very long time and not know it. But that entire time you have that infection, it's progressing liver damage. So it progresses to liver cancer, cirrhosis, and then obviously if you don't get treated, you will die then from hepatitis if you never seek any type of treatment. Most people don't succumb to the liver cancer, don't have liver cancer towards the end of their hepatitis infection, but it's always that possibility. And we don't know who's more likely to get liver cancer and who's not. So anyone who has hepatitis C, is best to get tested, notified early, and then get treatment if you can have that treatment.
And how common is it in the United States then, just in terms of the amount of people?
The amount of people. So in the United States, they estimate about 4 million people in the United States have hepatitis C.
Wow.
Hepatitis C is the most common bloodborne pathogen.
And if we were to ask you, bringing it closer to your home, how many people in North Dakota have hepatitis C?
So last year in 2016, we had 1,047 cases of hepatitis C reported. 5 years ago, we had 700 some, so it's about a 50% increase over the past 5 years in the number of people diagnosed with hepatitis C.
And do you find that for those cases, is there any sort of discrepancy between the numbers in the rural versus the urban communities?
That we don't see a whole lot of. We do see some disparities. A lot of our disparities are racial disparities. American Indians and Native Americans, we see a high racial disparity rate among that population. But as far as community prevalence goes, not as much there.
Okay. And you mentioned that hepatitis can actually kill you if you have it long enough. Hepatitis C specifically can actually kill you if you have it long enough. How likely is it that those that have hepatitis C will die from their hepatitis C?
So if you think of 100 people who have hepatitis C infection, between 1 and 5 will die from their infection without treatment.
But with treatment, are those numbers quite significantly lower?
Treatment is amazing, and it's super successful, and then you don't have those complications that you would have if you're not treated.
So if I want to avoid being one of those 1 out of 5 people, right? In this case, what...
Or 1 in 5.
One in
5 out of 100.
Yeah, so one of those
go.
20 people then, right? So one of those 20 people out of the 100, say if I start having symptoms, what should I be going to the doctor if I just have not, just like, is it just something that, like, because a lot of people will just not go to a doctor if they have some of these basic symptoms. They'll be like, oh, I'll feel better in a couple days. When do you suggest would be the best time for someone to consider, like, is it something that's just if it's constantly reoccurring, or is it more of just you should go to the doctor regardless.
So for hepatitis C, it's not necessarily the symptoms that are going to drive you to go to the doctor. It's knowing how the disease is spread and those risk factors. So that injection drug use or past injection drug use, even if it was only once, that's going to prompt you to go and get screened. So if you have continual exposures, then you need to be screened more often, perhaps even every year. So it depends on what you have done and what you've done in the past to drive you to be screened for hepatitis C. You can't rely on those symptoms because most of the times they don't happen.
So let's dig in on those risk factors. So you mentioned IV drug use. What are some other risk factors people who should consider getting screened for hepatitis?
Sure. So current injection drug users and past injection drug users, very important, even if it only happened once, even if it was a long time ago. You have to be screened for hepatitis. Okay. Blood transfusions, if you've received a blood transfusion before 1992, if you received clotting factors before 1987, they started heating clotting factors and it killed the virus. Other things, like if you've had tattoos in your home or in a setting that's non-licensed, I would get screened for hepatitis C. Other things, like if you were a healthcare worker, you should get screened if you've had an accidental needle stick. And then other people that need to be screened are children who are born to hepatitis C positive mothers.
Does that virus have any unique effects on children if they if the fetus develops in a mother who has hepatitis C virus? Do we see different kind of effect on the bodies of children than we do in adults?
There's not a difference,
Okay.
but there's no treatment that can prevent mother to child transmission.
Okay.
It's either 5 or 6 out of 100 children born to hepatitis C positive mothers will contract the virus from their mother. There's nothing you can do to prevent that. They simply have to wait until they're old enough to be eligible for treatment.
So according to like the CDC, baby boomers are more. They define baby boomers as people born between 1945 to 1965. That they are 5 times more likely to have HCV. Do you happen to have any reason for why that might be the case, or what exactly why do we call them baby boomers? And for those of us just less millennials that don't know any better, right?
Right. The baby boomer, I don't know if that's a term I think that's been used a lot for that particular age group. So that age group in the 60s and the 70s, they did a lot of different things. There was a lot of drug use happening. There's a lot of different things happening that we know today is not the best for your health. And what we didn't know when they were doing those things is about bloodborne pathogens and how they were spread and how to prevent it. So they were doing things that they didn't know could transmit disease. Even particularly in that age group, veterans have a high rates of hepatitis C because of how medical care occurred. So when they would do vaccination clinics, needles would be shared between the people who were getting those vaccines. We know that you can't do that today. That's never going to happen today. But back then, healthcare just wasn't what it is today. And so that's part of the reason why people are at risk, and they might not even necessarily recall that they had some type of exposure. That's why everybody in that age group is just recommended to be screened.
Okay, so that makes sense. Kind of like cast a wide net to make sure that nobody is being left out.
Right.
And so, in what kind of ways do you recommend then for folks that are looking to get screened done? Is there any sort of proper way? Should they just go through their general physician, or should they just try to? Are there any other options? I guess like any more public programs that are out there?
Yeah. So there are public programs. You can always go to your primary healthcare provider. But through the state of North Dakota, we have a program. We call it our CTR program. It's a counseling, testing, and referral program. We have 22 sites across the state of North Dakota that offer free hepatitis C testing to people who are at risk. So if you're at risk or you think you're at risk, you can go to those sites and you can get free testing.
Perfect.
That's great to hear.
Yeah, and we'll have to have you provide us with some of those sites so we can throw them in the comment section of this video for all you guys
Definitely.
out there. If that'd be all right with you.
Of course.
Awesome, thank you.
That way they can find the closest one to them.
Well, yeah, and
Sure.
and I think it's important too, because if you know somebody who may fall in that group, or that age group, and you know that they haven't been tested, you can maybe be a little bit more effective if you know where the closest place that you could send them to get screened is. after you have that conversation of, have you ever been tested for hepatitis C?
What we find in baby boomers is that they often say, I've had hepatitis, when what they can remember as being hepatitis was hepatitis A or hepatitis B. So they get them a little bit confused because they can be confusing. So hepatitis A and B, we have vaccines now for those, and you don't see them very often. But they were common when they were children. And so they had those viruses, they had the jaundice, they had the illness, and then they're thinking, I've already been tested for hepatitis C, or I've already had it. But they're very different viruses, and so they just get them a little bit confused. So getting that screening done by a provider today is still important to just double check to make sure that they don't have hepatitis C.
So this is an interesting question that I just kind of thought of when you were hitting us with that answer. I've never really thought about that being an issue, like the confusion maybe around the way that the medical terms are used to define these diseases being so close together.
ABC.
Yeah.
With the difference of ABC. I mean, do you think that kind of medical terminology and the way things are worded can actually have a major impact when you're looking at public health?
It certainly does. I mean, when you're talking about 3 viruses, hepatitis A is very different than the other 2. B and C are somewhat similar in modes of transmission, but people get so confused and they don't understand. A and B have vaccines. Hepatitis C, there is no vaccine. There's just so many differences. If they could have had a different term for each one of them, it would have been a lot easier.
Yeah.
But this general term of hepatitis 2, when you're thinking about hepatitis C and that risk factors injection drug use, and you say someone has hepatitis C because of they drink too much alcohol, I mean, sometimes, I have hepatitis, and then they think hepatitis C is, they might correlate with that risk group. It's like, no, that's not what you have. And so it does bring on a lot of confusion.
So you mentioned a little bit about the free clinics.
Yep.
Are there currently any programs other than those free clinics designed to kind of connect people to resources? I guess maybe to word it in a different way, are there any programs to increase screening in the public and connect them to those screening facilities?
So what we have through the health department, we have a contract with a organization that their main job is community outreach. And so we try to do different things in the community. Our community group is called the Community Planning Group. It is HIV and hepatitis C focused because we serve populations that are at risk oftentimes for both HIV and hepatitis C. And we try to do different community events as much as we can, be welcome. And unfortunately, that stigma associated with HIV also then translates a little bit to hepatitis C.
Why is there a
Why?
stigma with hepatitis C?
It's drug user health. I mean, people have that stereotypical image of an injection drug user that maybe they don't think that we should be spending any resources on someone who chooses to inject drugs. They're harmful. They're choosing to do that to themselves. There's a lot of misconceptions about addiction and what that means and how we as a society can help individuals. And it's not, it's a disease, and people, that is their condition, and we need to try to do our best to help them. And that funding and things like that is not necessarily allocated, and people have that image that that's not where they want their public resources to go.
And to kind of turn that on its head then, what is your response to that? That sort of mentality of why should resources be used to combat a virus like hepatitis C?
If you have hepatitis C, one thing about hepatitis C is it's curable. You can treat hepatitis C. Communities in Philadelphia and San Francisco both have end hepatitis C elimination projects happening right now. Hepatitis C elimination is truly a possibility, but it has to be a possibility with a multi-pronged approach. So you have to, with injection drug use being our most common risk factor, you have to eliminate the sharing of needles. So syringe exchange programs, they allow people not to have to share drug works. You reduce that disease transmission. You reduce that opportunity for needles to be found in communities, at the park where your kids could step on them, in the grass where you don't know where they are, and someone could get infected and they don't know it. Hepatitis C is a very hardy virus, and if you found a needle on a park or in a street, that hepatitis C can live in that syringe for up to 6 months.
Oh, wow.
And there is a lot of controversy around these needle exchange programs.
Definitely.
And, so what is your take to someone who might say that, if we're investing this money to have these needles, but just by what you just said, what if it just means there's more needles around filled with Hep C, around our neighborhoods? Like, because we gave them more needles, that there's more likely for a kid to stumble upon a needle. Or
Right.
as opposed to if they were sharing it, they kept it within the group of drug users, right? But, so is it to them? Is it just like, how do we justify that these things?
One of the big things about syringe exchange programs is that they do not increase the number of people who inject drugs. A lot of the public perception is that it's going to give people the access to inject drugs. If they're injecting drugs, they're already doing it. That syringe stringer is not going to do that. What that syringe service program allows for, it's a place for someone to get connected. It's a place for them to have that. I'm going in and I'm getting my new syringes or my new works all the time. I have somebody to talk to, somebody to listen to me, somebody to connect me to resources that I never knew existed. It gives them that comprehensive healthcare that they would not have been getting otherwise. And more people who connect with a syringe service program, those are the people that are more likely to get on treatment.
Very cool.
So in a way, it is actually just a very worthwhile investment. Just from looking at it from that perspective, because if the counter argument is that, is this a waste of money? If it's just, not, if it's actually doing good stuff for people that are already on it, then I guess it makes a lot more sense.
I mean, that's the whole goal, is to try to give people comprehensive health care, to give them the opportunity to seek the help that they need and when they need it. You can't tell someone if they have an addiction problem, today is the day that you're going to go to treatment. You have to let them choose when that's going to be so that it presents themselves the best opportunity for success. So in North Dakota, syringe service programs became legal just passed this last session. So August 1st of 2017 is the technical day that they are allowed to start. So we'll see how many programs will exist in North Dakota after that date, but certainly a way to stop and reduce disease transmission as well.
How has the stigma that we've been discussing affected hepatitis C treatment in the past in the United States?
In the past, so it is still happening today. So treatment, insurance programs and Medicaid programs that pay for hepatitis C treatment, there's certain standards that you have to meet. In North Dakota, as of today, the standard is you have to be drug and alcohol free for 12 months prior to starting hepatitis C treatment. There's no evidence to say that you can't treat an active user. There's no medical evidence that says it can't happen. They fear then that people, because once you have hepatitis C and you get treated and you cure yourself, you can get reinfected. So the argument then is public resources and you're treating someone who has the potential to become reinfected.
So really the 12 months is just kind of a superficial, just kind of like, or I guess the word would be artificial date of just of time to say, okay, after this period of time, we can actually utilize these resources because of the cost of them.
Because of the cost, yeah.
Gotcha. Okay. So in a way, if in a perfect world though, you'd probably just say, just handle it, right?
To be honest, it's very person dependent. Several years ago, hepatitis C treatment used to be really tough. Used to be hard. It used to be 24 to 48 weeks. You'd have to take pills every day, several times a day, and you'd have to take injections once a week. Very rigorous. There was a lot of side effects associated with that medication, and you had to take it every single day. Adherence was a huge issue. Today, your treatment could be one pill once a day between 8 and 12 weeks.
Oh, wow. So significantly different.
Significantly different than what it used to be. And the success rates are much higher, in the high 90s. Before they used to be like less than 50%. So treatment has changed so much in the past even 5 years that there's so much better options. But of course, with better options becomes increased price.
So I guess, do you see us eventually getting to a point, and maybe this is a more philosophical question, but eventually getting to the point where hepatitis C is no longer present in North Dakota or in the United States at all?
That is the goal. There's a National Academies of something, the technical name I don't remember,
Sure.
but they just released a report that on the elimination of viral hepatitis in the United States. They did a feasibility study on what needs to happen in order for that to occur. So it is a very real possibility, but it is going to take a lot of investment and time, what people might not have. But it's certainly an option.
What kind of points did that hit on as far as what needs to be done for this goal to be achieved?
So for hepatitis C specifically, it's that concept of harm reduction. You need to have syringe service programs. You need to treat so many people in a given year. And then you need to screen everybody that you need to screen, whoever's at risk. So screening, treatment, and then harm reduction.
And kind of going back, sir, you said that your job was as a hepatitis prevention coordinator. So what type of stuff do you do for your job that relates to, I guess it's in the title, it makes sense, right? But in the sense of what kind of stuff do you actually do out in the community then to kind of help, prevent the spread of Hep C?
So the big thing for prevention is education. So frequently it's PowerPoints or presentations to whether it's public organizations, people who serve people who are at risk, and then obviously working with our counseling and testing sites to get their information out into the community on where people can get tested and screened.
Just got to be careful to avoid death by PowerPoint.
That's
for sure, 'cause,
so right.
But yeah, so I guess in this case then, after working with your time and your experience, do you find that people are that are dealing with this type of issue, are they receptive to assistance, or is it a lot more difficult to get people who are suffering from Hep C to kind of go forward to utilize these services, or is it more of a just that they're more reserved and harder to get a hold of?
I want to say they're going to be more reserved. So we're governmental organizations trying to get people who inject drugs or have used drugs to come to a governmental place to get tested and screened.
Seems like a setup.
Yeah.
Yes, it seems like a setup, and that's what we've heard. And so that is not trying to reach our truly at-risk population is tough for us to get them tested. Because one thing that we don't have, if they're diagnosed with hepatitis C, we can get you tested for free. We can give you free vaccine, because if you have hepatitis C, you should be vaccinated for hepatitis A and B. But we can't get you treated. What we hear is, I have hepatitis C, so what? What are you going to do for me? Well, if you're doing these things, there's not a whole lot. But now, with syringe service programs, we have some place for you to go so that you don't spread your infection to anyone else. So education then becomes key, because with injection drug use, it's not just a needle. So everything that's involved in injection drug use, there's like tourniquets and water and everything like that. So on a surface, wherever you're doing that works, it can live to 30 days on a table. Bleach will try to kill it, but it might not be 100% effective. Okay, so if you're touching a table that maybe is contaminated and then you're touching your arm where you're going to inject, you've just given yourself hepatitis C or have that potential. It's very potent in that regards. It can live a long time. So at education, we want you to be diagnosed so you can be educated, because there's a lot of things then you can do to prevent yourself from getting the disease, or if you have it, preventing others from becoming infected.
And so just to make it perfectly clear, at these syringe exchanges, or if you come in to get screened, there's no sort of conspiracy to catch you and turn you into the police.
No. We are a confidential setting. No one gets reported. We don't, not that we don't care, but we don't care that you inject drugs. We just want to get you tested based on your risk factors.
Did they tell you to say that?
I don't care. You're obviously doing what's for you at this given moment in time. We're going to help you. We're going to evaluate you. Try to talk to you about some of the different options. If you're interested in treatment, we can give you those resources. If you're not interested in treatment, we can tell you, don't share this, don't do this, don't do these types of things that are going to put you at risk for acquiring hepatitis C or HIV.
Do you often see those two infections co-occurring?
In the nation, they do. In the nation, I think the co-infection rate is about 25% of people who have HIV also have hepatitis C. We do not have that high of a co-infection rate here in North Dakota.
That said, do you still recommend people who get tested for hepatitis to also receive HIV screening?
Yes.
Okay.
Always.
Always. Okay.
Always.
And vice versa?
Every screening done possible.
But not vice versa.
Okay.
HIV is sexually transmitted and injection drug use. Everyone between the ages of 13 and 64 should be tested for HIV. If you don't know your HIV status and you're in that age, you should know it.
Okay.
Okay. So then if you only have sex, if you're a heterosexual, you only need HIV testing. Hepatitis C is not efficiently transmitted sexually, and so heterosexuals don't necessarily have to worry about hepatitis C if that's their only risk factor. If you are an injection drug user or use drugs, you should then be tested for both.
Okay. And as far as men having sex with men, would they also need to be screened for hepatitis C?
Yes.
Okay.
That risk factor with anal sex poses that risk for more blood exposure, so then you should be tested for hepatitis C based on that risk factor.
So obviously with a disease like this that has historically had a stigma attached to it, it can be hard to discuss with friends and family if you're concerned about them potentially falling within one of these risk factor groups where they should be screened for this disease. Are there any guidelines that you could put forth that would maybe help start a conversation about hepatitis C screening or about hepatitis C virus?
You know, when it comes to difficult things to talk to, the best thing is being honest and open, and not you have to practice your judgment face. When someone tells you something that could be shocking, you can't go, oh my God. You can't do that. You can't have an oh my God face. You just have to be, okay, that's okay. Let's talk about that. The other thing is being informed. So even with HIV, as with hepatitis C, there's still a lot of misconceptions. So hepatitis C, you cannot spread it by kissing, shaking hands, hugging, touching, sharing utensils. Those types of things are not going to spread hepatitis C. But if you live in a household with someone who has hepatitis C, you shouldn't share toothbrushes. You shouldn't share razors. They just have that small chance of spreading the virus, of having blood on them. And because that hepatitis C can live for up to 30 days on that, you don't want someone sharing it, especially like a child. So you have to be honest with whoever you live with to make sure that you're all aware of things you should do and shouldn't do. In a home, if someone gets cut, you help them clean that up. But if you have someone who has hepatitis C, you want to make sure you're using universal precautions. I don't know that that's necessarily something that people practice in their home, wearing gloves to help someone clean their cut and things like that. That would be important to do in that situation.
So if you're shaving, make sure you're shaving on the switch and not the, switching with your family members, not shaving. Just
That's right. Use the Nintendo.
Use the Nintendo.
Use the Nintendo. That would solve all those problems, right?
And then you get good practice in too. So that's, and then you're less likely to, nick something and have an accident happen. So that's good.
Mm-hmm.
So let's say we're posed with this situation. Like say I'm out somewhere and somebody suffers maybe a very bad cut and I have no idea about their hepatitis C virus status, or I have a family member who maybe I even know that they have hepatitis C. Obviously, I don't want to sit there and just watch them bleed out. If I can apply pressure and try and help that situation, what do I need to do to protect myself and still help them?
The best thing then is some type of barrier between your hand and their blood. So whether like it's a towel or a shirt or something, if you have like cuts on your hands, you're posing a big risk. If you don't have cuts on your hands or anything like that, or your arms, you're fine. You have to have has to poke your skin. Through your skin. So just touching blood is not going to give you hepatitis and does not pose any risk. But if you come across someone, use some type of barrier between your skin and their blood.
This is very useful to know, because I know that a lot of people are like, the perception is that, first contact with something, or, we're used to hearing stuff about like, it differs for people, but like the 3-second rule for germs for food, right? Where it's, you drop something on the ground, or it's like, depending on how hungry you are, it changes, right? Where you're like, okay, 10 seconds or 15
just
seconds.
wipe it off, right?
Yeah. Should be okay, so no, but no, it's definitely good to hear. Do you think that there's any sort of, I guess, what about for like nails and underneath, I guess any of those areas where like there might be even a small amount of...
It still could happen. So if you're getting your nails cut and you get too close to your skin and you nick your skin, that blood then is on your nail clipper. So don't share your nail clipper then with anyone else either. So being just aware. And I mean, I'm at home. I don't clean my nail clipper with that professional solution you're supposed to probably clean it with, or bleach solution.
But the safe thing is probably just everyone have their own kit,
Yes,
right? Just everyone have their own.
Everyone have their own stuff.
Yeah. So what are some suggestions you could give to somebody who wants to help decrease the burden in their communities of hepatitis C?
Encourage people close to you to get tested if you know that they should be tested. That's the biggest thing that we need to happen, is that people who are at risk or don't know their status now know their status.
And how expensive is it to get tested?
So we have free testing. Hepatitis C screening is a preventative service, so there's grades associated with different testing. It's a grade B, meaning it's supposed to be covered by insurance at full cost. Okay, but with changing landscapes and insurance, that could all change.
Because I know that we talked earlier and you did the research on this, so we have to ask you this question. If you were a Power Ranger, first, what color would your Power Ranger be and why? And then I have a follow-up question.
I would like to have purple. I know purple doesn't exist, but purple is my favorite color.
It should exist.
It
should be
should.
a Purple Ranger.
There should not. I mean, typically red, blue, green, those masculine colors, black, pink. Pink is very girly, right? Very girly.
I like rocking pink from time to time, like wearing like a pink shirt, whatever works.
But I want purple.
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 The Purple Ranger.
Royal,
Yes.
royal color.
Yeah.
That's right.
And what would the Purple Ranger's Zord be and why?
I decided that I would be a frog.
The frog.
The frog.
The purple frog.
The purple frog. The frog can electrocute people, and I thought that was pretty cool. I don't know why, but I don't like heights, so I don't want to fly.
Okay.
And I like water, so I thought that was a good compromise. That's the frog.
So that's
is a
cool.
good compromise.
That's cool.
Yeah.
What about you, Mr. Ranger over here, Mr. Gryffindor?
Mr. Gryffindor. Well, you took my color, purple. I would love to have a Purple Ranger. So being that
See?
you have laid
Purple.
claim to purple, I have to fall in the fanboys that say the Green Ranger. Fanboys and fangirls. I would pick green because the Green Ranger was so mysterious, and he only had his powers were there, and then they were taken away from him. There's so much angst in the Green Ranger, so I'll pick the Green Ranger. Love the Dragon Zord. However, the T-Rex, the Tyrannosaurus of the Red Ranger, was definitely my favorite of the Zords. So it would be a green T-Rex for me.
Man, wasn't the Green Ranger also the White Ranger too?
Yes. I believe he did become
Just
the White
had two
Ranger
colors,
as well.
yeah.
He's that special.
Yep. See, I knew Mr. Gryffindor would pick that. No, but I guess for me, I'd just choose Blue Ranger. I like Billy from the original one, like the nerd with glasses. Just he was fun. And then I also agree with the Red Rangers because I don't know, it's just cool. But if I could pick one, I'd probably pick a rooster.
A rooster. Yeah. So we would have
just because it'd be so random again too, and kind of funny, right? So
we would have a rooster, a frog, and a Tyrannosaurus Rex coming together to form some sort of Megazord. I have no idea what that would look like. I think it's probably going to look pretty messed up. Just going to put that out there, but we'll fight anything Rita can throw at us. Thank you again, and thank you guys for tuning in to Ty and Sky's Health Pub today. Again, if you have any questions for us at all, or any questions you would like us to hand over to Sarah to help you guys answer, feel free to leave those down below. And if you know somebody who should be screened, we will put the resources that Sarah talked about today kind of down in the comments section as well. So you can find all that information there and hopefully find the nearest screening center near you. Other than that, again, like us on Facebook and hit us up on our other social media sites. We'll see you guys in the future.
All right, have a good one.